You are about to enjoy a production of the Ella Wellness Network. This is Wellness Fixes the Pod. I'm your host, Dr. Kelsey Vig, and I'm so happy you're here. Welcome to the Wellness Sisterhood. Today, I'm excited to have a guest expert on the pod who is dedicated to helping women in all stages of life with their nutrition, training, performance, and ultimately how they can show up in the world as the most confident version of themselves. She's a registered dietitian and owner of Nutrition by Mel. She's a certified sports nutritionist. She has a master's in nutrition and dietetics, and she has spoken for the likes of Nike, the Metropolitan Opera House, the International Society of Sports Nutrition, the National Strength and Conditioning Association. So with all of that, Mel Sulaver, welcome to Wellness Fixes the Pod.
Oh, thanks so much, Kelsey. I'm excited to be here.
Yeah, we're excited to have you.
Yeah.
So before we truly deep dive into all things nutrition, what is your deeper why when it comes to your own women's health education efforts and then also your clinical practice?
Sure. I mean, I think part of it ties into the fact that I'm just constantly trying to fill in the gaps that exist within the nutrition space, specifically as a female athlete. So, I was a collegiate athlete who was triggered into disordered eating, likely undiagnosed eating disorder by my college coach. And so initially, in addition to kind of like working clinically, because that is for sure the basis of our profession, and I have to say that because anytime new dietitians are like, how do I get into sports nutrition? I'm like, get experience working within sport, but also like you need to have clinical components because your athletes still present with gen stress and diabetes and all of these things. So it's really helpful to navigate that and then also just understand the medical system. So much of our initial growth is, I'm tangenting a little bit, but truly so much of our initial growth is about so much more than just nutrition. It's understanding like the scape of how nutrition fits into health and healthcare. And then from there, like different environments, right? Sport being one of them. So deep mission and addressing disordered eating, body dysmorphia within the context of sport, in particular, educating like coaches, trainers, athletic support staff on better language, better tools, so that they can have conversations and we can be more preventative. And then as it gets into like more girls and women's health specifically, just the education that we get for our bodies is so poor. To young men and young women, you think about health education class and watching this video of birth, and it's often like very traumatic and jarring and like taboo, walking around hiding tampons and pads as if it's something we need to be nervous about. So much of my work is about creating body literacy, hopefully in like younger women, so that as they go through different transitions, pregnancy, postpartum being, my hope is a chosen one for yourself, but we will all go through perimenopause and menopause. So if we create that literacy, that understanding of our body and our menstrual cycle and what's normal for each of us when we're younger, it allows us to make informed decisions as we move through life. So that's really the core of my mission is creating body literacy for young girls and women in sport.
I love it. I told Katie this too, but it's like my people, like our deeper whys are so aligned and so similar. And I just love like meeting people who are in this field who just like that is also their deeper why and their deeper mission too. And I think it's hugely important. And I tell people a lot because I've had a few patients ask me too, like, what do you think makes a good physical therapist? And I think exactly as you said, of like, we have the foundations that we're taught in school where it's like, okay, this is how our patient might present and they fit in boxes. And that's a lot of the time how it gets taught in school. But I'm with you in that it's like, okay, if we're going to be able to problem solve and have this like wider range of helping people and ability to help people, you need the foundation. So it's good to start out with that mentorship and that just seeing patients of all ages, of all sizes, of all health history backgrounds, and then diving into, okay, sports nutrition is where I want to be, or sports orthopedics is where I want to be with physical therapy. So I tell people the same thing where I'm like, there's so much benefit from this like foundational understanding the healthcare system and all that goes into that and all of the challenges that come with working with insurance and navigating different health professionals and all of that too. And on the like menstrual cycle health literacy thing, I actually saw something the other day. It's a developmental specialist of some sort, like a psychologist of some sort of like how we should be teaching sons about the menstrual cycle and like little boys about it. And
Yeah, I love that.
it was so cool because one of the moms commented, I was reading the post and it was commenting saying, my sons carry a period kit in their backpacks and they have a sweatshirt that has the pocket in it. And so if they see that one of their friends are leaking, like you put it in the pocket, tie it around, or like wear it, go up to her, whisper, say, hey, you're leaking. I have stuff in my sweatshirt, tie this around. And I was just tearing up, right? Like, you just mentioning about like, sharing that with young girls and young boys. It's like, yeah, the young boys too, right? It's cool because that often gets forgotten a little bit.
Oh my, yeah, it's not just for us to know, right? And you think about, especially in a sportscape, we have more male coaches than female coaches. And so just because you're a man, you're not immune to having this conversation. Like you also need to be informed so that you can best support your athletes. Like there is no excuse. Now, I think if you have, a female coach that has like a better rapport, you have athletes who are more comfortable, then that's a different story. But not everybody has access to that. So, how do we create better understanding? How do we create better education? Or like that access, because it's just not common knowledge, and it needs to be. It needs to be.
And less taboo, like you said, no more hiding tampon. It's like we all experience it, right? So it's like, why is this a big? And I feel like girls to girls, it's like way easier a little bit, but it shouldn't be taboo for a boy to say, "Hey, you're leaking," without laughing at you, right? It's like,
Yeah.
okay, that needs to be something that girls don't get embarrassed by because their guy friends care about them enough to. So I thought that was sweet that the mom had said that to her sons because they wanted to help their friends out who were girls who they saw have that happen to them. So you really help people throughout all ages, and I know I'm considering this kind of podcast part 1 because you've been kind enough to be like, "Okay, let's break it up a little bit and let's give each stage of a woman's life enough of a, like, time frame in order to dive in." So, today we'll cover sort of nutrition in our 20s and 30s as women specifically, and then next time we'll cover more of the pregnancy, postpartum, menopausal, perimenopausal, postmenopausal. If we can fit all of that in one too, that would be great too. But we'll stick today with what's kind of simplifying it down to nutrition, training, performance in our 20s and 30s, and things that we care about as women when it comes to our nutrition, training, performance, body image in our 20s and 30s. So, with that being said, are there certain things that we need to be looking at when it comes to our nutrition in our 20s and 30s through the lens of like the menstrual cycle or just in general? Like, from a broad perspective, what are some of the things and priority items that we should be looking at when it comes to nutrition in our 20s and 30s?
Sure. I mean, I think, to be clear, within the context of your menstrual cycle, like, do you have a normal cycle? Like, are you on birth control, or are you naturally cycling without the exogenous hormone support from anything? And if you are, is that regular? Is it consistent? So just for everybody to be clear, like, well, normal menstrual cycle is anywhere from 21 to 35 days, but your normal might be 26 to 28 days. Someone else's normal might be 31 to 33 days. If you're a 31 to 33-day cycler and you start having 26-day cycles, something's probably off. So just know what is normal for you, and then to just like debunk the cycle syncing BS that we are currently navigating. There's a lot of programs, recommendations based around doing this during your cycle, and it's really wild how it's gotten out of control, because we're beyond just dietary intervention and exercise intervention. Now you have people telling you, well, you should really rest, or you should not go to work at this point in your cycle. And listen, we have enough as like women, we've got enough barriers to entry that if we start worrying about that, forget about it. Forget about it. So you have more to lose by trying to just work within each phase or window than you do showing up for yourself. So, you know what? If you feel good, show up for yourself. Do not let that be the indicator. Now, if you want to make decisions based on your body, cycle sync your body, that's different. That's not making decisions based on someone else programming telling you you're in your luteal phase, do this, you're in your follicular phase, do this. It's saying, okay, track your cycle, see how you feel. Yes, there might be some benefit to be a little more conscious of hydration and sodium and electrolytes. There might be some benefit to paying more attention to having an extra snack or larger meal or some of these pieces, but that has to be based on you. So that's the first piece. By the time you're in your 20s, definitely your 30s, my goal for you would be to have an understanding of like what is normal for your body so that you can, yeah, make informed decisions on how you want to move about life and training from that standpoint. The any let's go pause there. Any like
Yeah, I love when someone, yeah, just talks on that because I do like I've been tracking my cycle for a while and little 20-year-old Kelsey, like I'm so proud of her for like starting that because I
yeah,
didn't even know what sort of awareness or patterns that I would be able to tell now that I am in my 30s. It's wild. But I'm a big proponent of the individualization because I've used since I have been tracking, I've used so many different apps to track and it's like, oh, you should be doing yoga in this phase and, certain lower intensity in this phase because of this. And so I've done like a menstrual cycle series on the podcast educating about this. And my whole goal with it was like, it's totally individualized. Your body, this might be what's happening within your body. If you feel a little bit more sluggish in your luteal phase, it doesn't mean that you have to stop strength training. It just might mean that you might need to recover a little bit longer in between
yeah,
sets or lift a little lighter weights. Like you don't have to completely flip the switch on from the movement standpoint, which is where I'm coming from things. Like you don't have
mhm,
to completely flip everything. And so I think it's great, like the awareness of your cycle and being able to have these patterns that you're tracking over time when it comes to how your body feels with fueling, how it feels after movement, even mindset, because I notice negative thought patterns of like, gosh, Kelsey, this, just different negative thought patterns happen more in my luteal phase. But again, some people might not have that, and that's okay. And
sure.
it's based on your body. So I love the individualized nature of that. So yes, I'm right there with you and thinking, yeah, cycle syncing. I hate that term. So it's just
Why?
working out with your physiology, but like your individual physiology, where it's like you're understanding, oh, I feel extra powerful, extra strong. Like maybe I can do that extra set or that extra rep where someone else might not feel that way until a certain different part. So it's definitely, I think that's why it's so important to track your own individual cycle and learn to do that too.
Totally agree. And I think the other part is being open to it changing. So, your cycle outside of, pregnancy and even perimenopause, like your cycle is going to be relatively consistent, right? Unless you have some sort of severe trauma injury, unless you are diagnosed with something like PCOS or there's some underlying medical condition going on, or you're struggling with low energy availability, right? Like it's going to be pretty consistent. So knowing what your rhythms and patterns are going to be really helpful for you. Um, and what you need to manage that or what feels best in your body, be open to that changing. So, it's also easy to be like, this is the thing that my body does. And it's like, your body is going to change. Like you are going to change. Your various stimuli are going to change, right? We change different jobs and that can dramatically change. Like, are you going from no commute to having a commute? Like, are your movement patterns changing because of it? Are you going from participating in specific types of sports to now like going and training in a gym? Like all of the different inputs you have to your body have the ability to impact that and how you feel and your energy levels. And so just being open to that change and a reevaluation of like, what's my baseline and where do I function from is really important.
So for general like guidelines or recommendations for our 20s and 30s, are there things that you're like, okay, I think in general people should focus on this because of just the ability to build muscle in our 20s and bone mineral density and all of these things? Are there certain things where you're like, okay, when I'm working with clients who are women in their 20s and 30s, who are athletes, the everyday athletes though, not someone who's this high level college athlete who is continuing at that high level sport, but more of these like everyday athletes. Do you have general things that you're like, okay, make sure this is in check, make sure this is in check, like different sort of check boxes that you look at when working with someone like that?
So I think the bigger piece is let's talk about like the hierarchy of needs for your body. Being in a state of energy availability is the most important, right? So making sure you're eating enough to support your body's baseline, in addition to all of the things that you're asking for it, right? And that calorie level, that macronutrient context is going to be different for everybody. And just an FYI, a chronometer or a fitness pal or any of these calculations is probably not the best way to assess it, just being clear. Actually eating regular meals throughout the day. So, it doesn't even have to be 3 square meals. The recommendation I like to give is making sure you're having something every 3 to 4 hours. Like you should be, like physiologically, you should be hungry if you haven't eaten for 3 or 4 hours, especially if we're talking a meal that does include some sort of protein, some sort of like starchier carbohydrate, rice, potatoes, pasta, plantain, something along this line. And then you get into like veggie and fat kind of like sprinkles on top of it, right? So the structure of that plate, we can talk about it in terms of performance plates. I really like for most people, especially my active, the population I work with is as expressed, like either identifies as a female athlete or is an active individual who's training 3, 4, 5 days a week, maybe working towards specific types of events, sporting events, endurance events, whatever that might be. So breaking up your plate into thirds is a good place to start. I feel like it's important to talk about the plate because protein is having a moment, which is great. Love protein, but like if we're having so much protein or we're so focused on protein that we are now not eating carbohydrates, especially starchy carbohydrates. So one of the concerns that I have to see, it's probably easier to speak to that too, is, an obsession or fixation on clean eating or whole foods, getting a majority of carbohydrates from fruits and vegetables. And fruits and vegetables are great. Fiber is great. Too much fiber does not help you. It doesn't help your hormones. We actually need to have a certain amount of starchier carbohydrates. Again, easy to digest carbohydrates, easy energy that is readily available for our body. Otherwise, you might start to see changes in your menstrual cycle. You might start to see changes in your bone density, which is not something that we want to compromise at this time, because by the time we turn 20, our bone density is established, essentially. So just even backtracking a little bit to adolescence, between the ages of 13 and 18, by 18, you've accrued 90% of your bone mineral density. So after that, we're just hanging on, right? Like we can buffer, we can build minimally. I have worked with women in menopause, particularly like within 60 and 70, who have been able to put on a small bit of bone density. Like it is possible. It's not easy, and it requires like very specific regimens to do that. So we don't want to be playing catch up. By the time we get to our 20s and 30s, we want to have accrued as much as possible. So, and like set ourselves up for success physically there. So, really making sure that you're eating those 3 base meals. And that's a good way to think about setting up your plate. And then where snacking comes into play is, I would say most people, in especially like more traditional work environments, might have breakfast somewhere between 8 and 9, lunch between noon and 2, and then there's this huge window until dinner. So a lot of people I end up seeing might go 6, 7, 8 hours before they eat dinner. We either need to get in another meal. There's enough room to get another meal if your work life allows for that, or your day to day, right? So depending on the job you work, you're probably not going to be able to sit down and have another meal. But what we can do is plan to have some robust snacks to bridge the gap between that lunch and dinner. So you think of a meal as something that would physically satisfy your body for 3 to 4 hours. A snack is something that would physically satisfy you for 1 to 2 hours. So it helps to bridge that gap. So think about it that way instead of, I think typically I say the word snack and someone thinks of chips or pretzels. Like we think of specific types of food, but your snack can be a smaller version of a meal. It doesn't mean that there's not a place for snack food or like the chips and the ice cream and like there's a place for all of it. And I think if we can focus on like, what am I eating to address physical hunger versus what am I eating for taste, for pleasures, for celebration, or like, how can I incorporate that into my day to day if that's what I want to do? Because it can. But if you're eating for taste and pleasure when you're looking to address physical hunger, that's when things tend to not be supportive for your body, because you're either going to be hungry again in an hour or two, or if you're just eating based on taste, you're not necessarily paying attention to physical hunger cues. So those would be my bigger notes within this population.
I think that's awesome because, yeah, I think I look at it. So I was a big MyFitnessPal user in college. So there we go. For the body dysmorphia, counting calories in, calories out, not gaining the freshman 15 mindset that I've been working to get out of, but I look at it from my time in school for that. It was like the calories in, calories out mindset, right? Just like that's only what matters. It doesn't matter what constitutes the plate, like it's calories in, calories out. Then we move into the vegan, vegetarian push, and then the keto, paleo push, and now I do feel like it is that like protein push where it's like, okay, if we're just focusing on the protein, that's why I'm glad you mentioned like the importance of everything else too, because I feel like I often forget about it too, where I'm like, okay, I see all this protein, like we need to, for some reason that's this big push right now. And yeah, it is important and it helps build muscle and all of these good things, but forgetting about the glucose and the carbohydrates and all of that other good stuff too. I get stuck in that cycle of like, oh, that's right, I haven't had any carbohydrates. So when you're saying thirds, so just so I can be more clear, protein a third, carbohydrates a third, and then you said sprinkling vegetables and fiber in for that last third, or
so if you think about a plate,
mm-hmm.
and you break your plate up into 3 like pretty even pieces.
Mm-hmm.
You want some of that to be protein, right? So if you are an animal protein consumer, it could be eggs or chicken or fish or red meat of any sort of kind. If you're more of like a veggie forward eater, that would be beans and tofu or another form of, tempeh, another form of soy that would kind of like cross with your starch, your carbohydrate side, right? So rices, pastas, potatoes, things like that. And then your other third would be your veggie. So that would be like your fruit, veggie, color. Just think like the colorful part of your plate. So a lot of times what I end up seeing, especially in female populations, is I need to be having half a plate of vegetables or half a plate of like color, right? So everybody is very focused on getting in that color and that fiber. And the thing that gets missed is the essential, carbohydrates. So especially the starchier ones. So a lot of people are wondering why they struggle with low energy availability. That's a lot of what I end up seeing. Or again, just working through the body dysmorphia, struggling relationships to food. And we need to work to normalize taking in carbohydrates that are starchier in nature. And again, just like more readily available for the body. And then you just start to notice you feel better, you feel fuller longer, your meals are much more satisfying. So the fat, like think of your fat as sprinkles, cheese, dressing, olive oil, avocado, nuts, seeds, like that would be like your dressing. So think about that as your sprinkles. When I'm working with someone who's in a season of like training for something specific, so I'll use building towards a marathon, for example, that plate shifts. So you are eating more, but like the volume of food is just going to change. So now we're doing more like half of that plate is the starchier carbohydrates. Then you prioritize protein, and then the veggies really become the sprinkles. Like we need different nutrients depending on what we are asking of our body. And that I find is it's hard for people to recognize because they feel like, how could I do this? Or I'm going to gain weight, or my body's going to change, or this isn't what I need, or this person says I need to just be eating protein and veggies, right? Like I don't need to have this, but that's when we start to have issues. So you do. So even getting into, would love your thoughts on this, just given what you do, is the movement side, right? So when I have people who are constantly training, again, marathoning as an example, like the conversations I have with them and their team, because I'm always working in a team with PT and a team with a strength coach and a team with a run coach, whoever the people are, it's what are you racing? So like, let's talk about what you're racing or you're really planning to compete in. And then let's talk about the events that you're participating in purely because you love to compete. Because if we're building towards a very specific rate, like you're planning to push that, then we have to eat differently than in a down season, right? Or like, if you have 3 or 4 months between races, then that's when I'm going to focus more on more veggies, more fruit. Like we're really antioxidants. We're going to really like nourish your body with these types of nutrients, because when you're in the middle of a build, it's about making sure you have enough energy. So the fiber and the color is not as important as making sure you have enough energy. And that's a hard thing to shift when culturally, again, I think in particular, the aesthetic is very tied to performance.
Totally. From my standpoint too, it's like looking at, especially if I'm treating someone who's had a history of injury and they are in that like push build phase, it's like,
Mhm.
okay, if your goals are like a PR or something like that, we might actually loosen up a little bit on some of the rest protocols. It's like, okay, we might have to shorten that expected recovery time, knowing that you are going to be in the season of recovery after your big push. So it shortens the time span a little bit. But I think either way, it's important that we understand that there are shifts, right? It's like
Yeah.
same thing where it's like nutrition doesn't have to be so regimented throughout the lifespan in a certain way. Like this is my plate. She told me this, and this. So that's what I got to do. But understand that there is this shift that can happen and that possibly needs to happen depending on like, and again, we'll talk about pregnancy and menopause. Like I know that probably shifts a lot too, but understanding that it is okay that we have those shifts and that's a good thing for our bodies and what we expect in regards to what we want to do for performance or training or yeah, relative season of just like rest and maintaining our fitness level without having to like push or train for something. So do any of these things become more something we should be more aware of when we have certain conditions like PCOS or endometriosis, or I've had questions on hormonal hair loss, like just different things where when we're talking about like hormonal imbalances that are more common with women with the PCOS and endometriosis, are there certain things that we should be more aware of when it comes to building our plates with those? Or does it just become more important that we are maintaining some of those good principles and that good plate building and those good snacks throughout the day?
It's a good question. I think again, it depends on the person. So like PCOS, there's a couple different drivers behind PCOS. Like you could really kind of break it down into 4 things between like the potential for someone who really does struggle with insulin resistance, for someone who does have more of a dominant androgen profile, someone who might struggle with tolerance of something like gluten and dairy. That doesn't mean that that is everybody. And so part of these diagnoses is understanding like what are your main drivers or triggers. Endometriosis similar, like we continue to learn a lot more about it. Fortunately, we have better ways of getting it diagnosed, or we have women who are advocating for themselves. So it's not taking 10 years, I hope, to get that diagnosis. We can get it sooner. Um, I mean, I can't tell you in the last 4 years how many people I've supported, more than I would like to see, who have been diagnosed with infertility and gone through rounds of IVF. I mean, crazy amounts of money to then find out they have endometriosis, have that procedure done, and then they get pregnant. You know, it's we still have a long way to go. But yes, when we look at kind of like a hierarchy of what's important, especially again, if you are an active individual, like you still need to be eating enough. So the difference in some of this might be coming back to like recovery time. So, if you're training really, really hard, are you prioritizing your recovery the way that you train? Or are you just someone who likes to drive and like there's no foot on the gas? And at some point, your body's going to shut you down. And so if you have any of these conditions, or you could throw in autoimmune conditions as well, your body will shut you down. At some point, your body's going to shut you down. So a lot of this continues to come back to that core, like literacy piece, like know when to push, know when to pull back. And if you need more of that, because that's beyond just nutrition. I mean, that's your, like, are you in a season of getting really poor sleep? Are you in a season of like very high stress? I will share, I'm going through a lot of life transitions right now. I'm having a baby in 4 to 6 weeks. We just bought a house about a month ago. My husband started a new job in October. My son just started preschool. Like those are all really big things in isolation. So together, it's very overwhelming. How I manage what I'm doing has to be different than when I'm not dealing with any of those things, let alone one of those things. So know where you are in your season of life and the other things going on outside of just medical diagnosis or just your training. And that'll help you make a decision about what pillars, if you will. If you think about sleep, stress, movement, and diet as a pillar, right? If something is totally out of whack, then none of it's going to work. So how can you find a little bit more synergy, even if it's not perfect, is going to help you make an informed decision. But always, again, like eating enough, prioritizing nourishment has to be the main necessity because, you know, society will continue to sell us on what is sexy, which is hormones and cycle syncing and protein and creatine. And creatine is amazing, by the way. Like we can talk about it, but just meaning none of those things are a cure-all. And you can take creatine, but if your diet is not, so, you know, if you're not eating enough to support the energetic demands and things you're asking of your body, it's not going to matter. So you have to nail enough first, at least from my realm of things, which is food.
That's one of the questions I get asked a lot is like, okay, what, especially because I do a lot of live events with college girls. And so a lot of the questions revolve around what supplements should I be taking in my, upper teens, young 20s, because they do have this desire to improve a lot of these things: muscle mass, bone mineral density, heart health, body composition goals. They have a lot of these goals and they're starting to be, I feel like people are starting to educate more on this. So with all of that, do you have certain things, like even supplements wise, and you could say no, like definitely just get your basics down, or if you're like, and again, I know this is so individualized
Yeah.
person to person, but are there things that you're like, okay, knowing bone mineral density, or bone mineral density all peaks in our 20s, and like the ability to improve that decreases linearly over time, knowing those sorts of things, are there certain recommendations that you have for people to either look into for their own bodies, or pay more attention to? And what supplements might you have recommended in the past to people that might be something to look into for some of the listeners?
Sure. I think there's definitely a core list that's worth paying attention to, but echo, like, yeah, nail your baseline diet first. Otherwise you're just wasting money. So like I have to say that. If you like really kind of nailed your rhythm and fueling, then creatine for sure would be a top. Just a teaspoon, kind of like one serving, 5 grams a day is like a great standard. Probably benefit from more than that, but that would be like individual discussions. I would say start with a 5 gram is the best studied supplement we have. It also we continue to see more and more specific to female physiology outside of just performance, why it is worth taking. I think vitamin D is also a valuable take. Somewhere between 1,000 and 2,000 IUs a day is more than appropriate as like a baseline recommendation. And then what I would say is, I know we'll talk later, and in another following about conception, but if you are in your 20s and 30s and you're thinking about getting pregnant within a year or two, start taking a prenatal vitamin at least a year out. It's like a safety net. So it's not going to hurt you to do that. And then from there, you can get a little bit more nitpicky and specific. But those would be the big ones. Nutrients of emphasis for female athletes as a whole are always going to be iron, vitamin D, calcium. Calcium, I'm cautious about supplementing with the exception of certain populations because of cardiovascular risk. Probably not necessary. It's also easy to get calcium in your diet. If you are vegan and you do not consume any dairy, or you are lactose intolerant, and if you do not consume any dairy, be conscious of like your leafy green intake, broccoli. You could also look at, if you like fish, that wouldn't speak to vegan, but someone who is maybe lactose intolerant, doesn't consume dairy, like fish on a bone, or like fish like tinned fish. that typically has some bones that are, you're not going to taste them, but they're part of it. Like incredible sources of calcium there. Iron, again, iron is pretty much a one-off single recommendation because the side effect of constipation is pretty uncomfortable. So if you do end up taking it because you have low iron, again, not going to give a specific dose on that because that's person to person specific, but start with every other day. That can help mitigate it. Iron is also, again, especially if you're someone who does consume animal-based protein, red meat's a fantastic source. If you can occasionally get in some sort of organ meat, liver, kidney, heart. There are some great blends now, like ground meat blends that include that as part of it. I used to have clients have to like chop it up and put it in. Now we don't have to do that anymore. It's amazing. But things like that, we can definitely get those nutrients through food. But those are ones that we're kind of at more of a risk for. So just being thoughtful about it. And vitamin D is not easy to get through your diet, and we are definitely not getting enough from the sun. So sometimes you'll hear like, take it in the winter and don't take it in the summer. And I'm like, no, have seen enough people with low vitamin D throughout the year. Unless you live very close to the equator, 1,000 to 2,000 IUs a day is not going to be an issue for you to take.
I get that question a lot of just like, yeah, different supplementation. And I think, I guess an overarching theme before we move on to another like very important topic in this age range, but I think I said to people in the menstrual cycle series, like the learning curve can be pretty big, pretty steep for learning about your body. I feel like tracking your menstrual cycle takes time, like understanding, oh, I'm feeling this way at this point in my cycle. Oh, and I'm feeling it again in this phase and this phase and this phase. And same thing with nutrition. Like it might take a bit of experimentation and balancing with like your training, like how much you're training in one season, and your nutrition might change, depending on that phase. And it should change based on where your energy is going towards, and what life stresses and all of that. So I think the biggest takeaway for me is like, okay, just start to be more aware of like the plate building. So taking, Mel's recommendations and then seeing how your body feels, knowing what phase of your training you're in or what phase of life you're in with, high school stress or high work stress or moving or, and we'll talk pregnancy, like that's a whole nother realm, but it might be a steep learning curve, but I think it's worth it to be able to like track and figure out when you might, you know, divert from that baseline, what your normal is. And if you need more of the guidance, that's where Mel comes in of like, okay, I'm struggling with this, and how can I better assist my body in fueling the way it needs to and feeling the way it needs to, given my training demands and my, again, like all of those external circumstances, moving, changing jobs, whatever that might be.
100%. It's always going to be detective work. The difference is when you do it with me or someone like me is it's more guided, right? So like working with me, it kind of looks like this, whereas sometimes doing it yourself is like, here, it can feel like you're throwing darts at a wall. So, obviously I'm an advocate of coaching. I genuinely believe it's invaluable. And, the other piece is depending on the person, right? Like I have people who I work with whose like situation, I'm going to say, is a little bit more stable or consistent. I have other people I work with whose situation is, there's like a lot of chaos, right? So you can do it either way. Like no one, most of my people live in a bit of like chaos. Like that's just the nature of their life, be it because of a marriage, because of having kids, because of a life stage, because of their job where they're traveling constantly all the time between different continents and time zones and things. So you're capable of doing it no matter what life looks like for you. Just know that. And yeah, when you work with someone, it's facilitated guidance. But I always say there's two experts in the room. There's me and the thing that I do, and there's you, and you're the expert in your body. So whoever you work with, in whatever capacity you work with them, physicians, physical therapists, dietitians, coaches, doesn't matter. You need to feel heard, and you need to be an active participant in that conversation, because I will always be looking to you for feedback. How does this feel? Did that work? Did it not work? Again, I have a lot of tools in my toolkit, and we just need to see what is best for you in this particular moment, knowing, okay, that could very well change. And then we can use other tools, no problem. So, if something isn't working, there are other ways that you can do it. So anytime, especially within the world of nutrition where there's a lot of dogmatic practice, or we have keto and carnivore and paleo or clean, or whole 30, it's not going to be the thing that works for you. You might have different pieces of all of those that are helpful for you in a particular season of life. That's normal. Trying to fit yourself into this box, even going back to Kelsey, what you had said earlier, even within medical systems, right? Like we're constantly trying to fit people into boxes. Makes me crazy. Whereas like just where are you in this body in this moment, and how can we best support you in doing the thing that you want to do?
Totally. And I know I'm asking Mel a lot of these like broad questions of, how would you best, support someone in their 20s and 30s? And it is totally individualized. Like it's like asking me, I have low back pain. How would you treat this? It's she's doing such a great job of providing these broad responses, but just understanding that it is individualized and these are broad recommendations, but like having that true guidance and the ability for professionals, whether it's a physical therapist or a dietitian, to be able to pull from their tools in their toolbox if you would like more of that specific guidance and like narrowing up that pathway of like extreme experimentation, then that's definitely the route to go, because these are broad recommendations that might work, but again, it's totally individualized, as nutrition and movement and training and all of that should be. So switching gears a little bit, body image, something that I've struggled with, again, probably from the MyFitnessPal days and even before. I feel like I don't know one girl. I was trying to think of percentages, right? Like I'm sure it's hard to study this, but 100% of the people I know have had some sort of females that I know have had some sort of body image issues and body dysmorphia. And our body image is usually heavily tied to how we look in our bodies. And with that comes like our nutrition and our training. And I know that you probably work with women a lot on this, whether that is, high schoolers up until even, I'm sure people in the menopausal and postmenopausal states or phases are not immune to this, right? It's something that we're constantly having to work on. So how do you approach that with someone? And do you have any sort of like mindfulness tips and tricks or journal prompts or things that questions you pose to people to help them switch their mindset to realizing their confidence and their self-worth is not tied to how they like the way that their body looks?
Yeah. Most of the one-on-one work I do is with women between the ages of 30, I would say, and 55. That's like average. I have two that are in their 70s. They're in their sexy 70s.
I love it. I love that.
Yeah. And then occasionally I will take on a younger female. And if I'm being honest, it's because within this context, almost always I get stuck in support of them because one, if not both of the parents has issues. And so they're in this environment that just continues to, it's really hard. It's really hard to support adolescents. And I give kudos to anyone who does. So, but yeah, do not often take on young athletes. The education I do with young athletes is like group, coach, big. But specifically, I do a lot of unpacking and rebuilding. So as a dietitian and a counselor, I would say, it is unpacking narratives. So especially as I see it present or re-present, and we'll talk about this a little bit more, especially within pregnancy, because that comes with its own triggers. And perimenopause, again, like anytime your body is changing and you're someone who has struggled with this in particular when you were younger, you're almost re-triggered. So what I have found, and some of this is, again, even I went through this as well. I don't know that it's ever gone. I think you learn to manage it. And those voices or drivers that led you to make restrictive decisions, dietary or excessive exercise, however you're purging restrictive behaviors looked like, right? Or overeating abundance issues, those voices become less and less and less. And so you learn how to manage it and you learn how to be aware of what has the potential to set you off. And so as I do that work, it's understanding the narratives that play out for us about food, the narratives that play out for us about our body, within food and our body and ourselves. And so once it starts to get into, every once in a while, it's identified that that's not your voice, that's your mom or your grandmother or your aunt or your sister. Or I've even seen some daughter to mother changes, which is interesting, right? As soon as we start to get into there, I immediately bring in therapy. So work very closely with therapists depending on severity and when it starts to get outside of my scope. But ultimately, even together, it's what are the different narratives. So the journaling prompts, again, a little bit more individual, but if you have certain thoughts that are playing out, if it's negative self-talk, just write it down. Like if you catch yourself questioning yourself or should statements, I'm very hyper conscious of when I use should. So like I said it once in this podcast as part of like your plate. Your plate should look like this if we are eating for physical nourishment. I believe that. I think should is often thrown around and creates guilt and shame if we don't do this thing. So some of it might be having someone catch how many should statements are you using on yourself, or like how often do you say this, or how often are you apologizing? What are you apologizing for when it comes to like these specific categories? Again, the therapy piece comes into play with someone because oftentimes there's boundary setting work that needs to be done. So that's a lot of it, I would say, is unpacking and rebuilding. So we're unpacking unsupportive narratives, identifying voices that are not yours, were never yours, to carry, and rebuilding things that are more supportive. Or, at least on the food specific front, if we're working through something food based, it's doing exposure exercises. So depending on what is troublesome for a specific person, how do we create safe environments for you to expose yourself to a certain type of food? Or eating out, if it's someone who feels like everyone is watching them when they're dining out, what is a safe environment that you can eat around other people? So things like that.
So one of the questions I wanted to even ask you, and I think it's great that because I didn't even think about this from the standpoint of familial or close relationships feeding into it, where I think of it more from the social media standpoint or something where we're seeing all of these people with different bodies and we feel like we should look that way or something. But even from the stories that have been told to us from different women or men in our lives, and so one of my questions to you was, and I'll still pose it to you, how do you think like raising your own kiddos, what are you going to try and do to make sure that we're limiting some of that worth coming from how we look or some of those that that body dysmorphia issue that we all have seemed to struggle with at one time or another as women?
Well, I think part of it is, and I have a son right now, I'm going to be birthing a daughter, but I want him to have that as well because men are definitely not immune to this, and that's its own shame taboo cycle. But I think a lot of it is language. How are we talking about bodies? Why are we talking about bodies? Like all bodies are good bodies. Healthy. I'm always very thoughtful. Like healthy is something that looks different on everybody. There is not a look to health, period. Like end, truly like big end of discussion. Bodies are comfortable at different weight shapes and sizes. How we define health for ourselves, that's a big exercise I do with all of my clients, especially when this is part of the conversation. Like, how do you define healthy? Like, what would healthy feel like in your body? Not what it look like, what would it feel like? Or what is your body capable of doing when you are healthy, right? So we're taking away healthy looks like this. I look like this. And to be clear, I'm all for like a good aesthetic shift, shred, recomp. Love to see what bodies are capable of, but not at the expense of your mental health, and not if you think about your value system as a series of buckets, that's another way to explore it is where are the different places you put value, right? So from 0 to 100, if you could label that, where would things be? And if a majority of your value is based on how you look, we need to address that because I don't care who you are, your body's going to change at some point in time, your body is going to change. It doesn't matter how old you are. Like, we will get older, like things are going to happen. And so going back to how I might see this present in different people, because just for me, the vast majority of people I support have had some sort of disordered eating behavior or eating disorder thing get re-triggered, or we're managing it later on in life, right? Um, there's a handful of times in the 12 plus years that I've been practicing where it happens later on in life. So that that isn't to say that it doesn't happen later on in life. I know for sure that it does. That's just not what I see within my population. So I'm more addressing, things that maybe they thought they addressed that continue to come back up. And it's like, why is this coming back up? Why now? And again, a lot of that is like deep narrative value. So I think I
And
answered the question. I was a little tangency. I'm sorry.
that's okay. That's okay. I'm a queen of tangents. So I think I resonate really with like the language shift too. Like you said, should statements. I've never thought about that, but I should
Yeah, use it. It's
be
good.
this. I should look like I should do this. I should be sleep, whatever it is. And I've realized even switching some of the way that I talk to myself, like I've said fueling a lot, and I feel like you've said fueling a lot, where it's like building up my body, looking at food as fuel rather than calling it like, oh, the diet that I follow, even if it's not a real keto diet or paleo diet, it's just like, oh, my diet, my general diet, like that can be a triggering word for me and other people too. So looking at it as like fueling and building up. So I think, yeah, like you said, language matters. And
Nourishment is the other one. Like, language
yeah,
is really valuable.
and sharing that with kids, right? Like
Mhm.
that's going to be one of my big things is with yeah, sons, daughters, whoever, right? Nieces, nephews, like
Yeah.
all of the above of like, okay, this is feeling your body. Like, how you, especially with my nephews are in sports, and I'm like, oh my gosh, that means going to help you, hit the ball a little further, because of, and like tying it a little bit to this like positive outcome that they want to have in their performance of whatever. So yeah, I think the language piece is super important. So I'm very glad you brought that up.
Yeah. I mean, and with little, like my son is 3, right? So with little kids, developmentally appropriate language, but stay away from good and bad. Like, stay away from good and bad with language. That's really a safe, or forbidden things, or like special things. I do think, and I don't want to shame anybody who does this, but like, if you're using food as a reward, it's a tricky path to go down, right? Same thing. I'm not going to say it's good or it's bad. It's a hard thing to correct. So can we avoid using food as a reward? In some ways, just normalizing things that we eat for taste versus the things that we eat for physical nourishment. So like, with, and it's just, everybody has different feelings about it. Like, and I'll be on, again, my son is 3. Do I feel like he needs to have dessert after every meal? Probably not. He's 3. Like, his taste, everything's still developing for sure when he was like a baby. But, if we had ice cream or a cookie, he had ice cream or cookie with us. Do I feel like I need to buy him his own ice cream cone at 2 years old? No, I don't. He can share with me, right? But like, you can make your own decisions on that. Like, we can make informed decisions, but normalizing these things is okay versus you can't have that, or don't have that, or that's bad, or like wait till dinner. You can give them, every once in a while we'll take out ice cream and like we'll have a scoop before dinner. Like, this isn't special. It's just part of it. Tastes really good, and I know you want to eat a lot of it, right? So as he gets older, we can have more conversations about, okay, how does it make you feel if you eat a lot of these things? Because the food environments for kids, as soon as they're outside of us, they're going to have access to a lot. So I think just being open about having conversations about how does that make you feel, coming back to like, they might be little, they're still the expert in their body. You're not in their body. So you can't tell them how they feel. Like, let them tell you and just talk to them about it in a non-judgmental, keep it curious, lead with curiosity. That's another great like tool that I can give you. Like, please lead with curiosity around food versus judgment. Just stay away from judgment. And that's especially with kids, that's a hopeful place to come from.
And I'm so glad that like even you and your work that you're doing with all of your female athletes, it's like it's trickling down. One of these days it's all of our daughters and granddaughters and great granddaughters and sons and grandsons and great grandsons. My hope is that some of these like epigenetic pathways that we're all sort of like have in our brains is eventually it'll die out a little bit where we are more aware of how we're sharing this information, how we're talking about it with the younger generation so that maybe the things that they have to go through and rewire in their brains aren't as much of a delta between, where they've been, where they have to go with some of these behaviors. So before we end, if we've covered a lot today when it comes to like women in their 20s and 30s and just like even high school, we've covered a broad range today. Is there anything that we haven't covered that you're like, I really wish I knew this as someone in my 20s or late teen years, or something that you wish young women would know?
I think the big thing, especially as young women, is take the time to understand your menstrual cycle. And like, I want you to ask for what you need. Like, ask if you want a resource, if you want a tool, if you want someone to come talk to you or your team or anything, like ask for that. And if you're afraid to ask for it on your own, like bring your teammates with you. There's power in numbers. You deserve to know what's happening with your body. Like, stay curious. And then, just be thoughtful. And it's a hard conversation to have, especially with young girls, is like, the things you do now will impact you later on, because your scope of the world is so limited. You're just kind of focused on what you're doing. How could you not be? But again, your bone density in particular, of all the things, like, you are setting your body up now for what is going to happen for the rest of your life. So that's a hard thing. That's like a lot of to understand. There's a lot of gravitas there, but if you feel like you're struggling to eat, or you're getting mixed messaging that you shouldn't be eating, we need you to eat. Again, like, your needs for growth are very high. And then when we start to throw sport and exercise on top of it, like, you need a lot more than you think you do. So, if you're struggling with that, please reach out for help.
As someone who definitely in that time frame was more of that experimentation on both ends of the spectrum, where under eating, over exercising, because in my head that was what the media, that's the education that I was consuming was, that mattered, right? If I wanted to maintain this healthy weight and this healthy look about myself, this is what mattered. And I think people are starting to realize that younger and younger, but it is like, thankfully, there's people out there like Mel who are helping to educate on all of that and just helping us to, set our bodies up for the long term, because we have this massive room for growth and change and building up in our late teens, 20s, where it's like this is the time that we can maximize and optimize some of these things and really fuel our bodies in the right way to build us up to be sexy 70. So
Yes, yes, definitely. Love it.
let's all be sexy 70-year-olds.
Think about it. There's a whole nother half of life to live after 40. A whole nother half of life. And that's if you live to 80. Like, you can live beyond that. So why does the fun have to stop?
Yeah, I love Sexy 70. I haven't heard that yet. I'm gonna have to share that with people too. Well, Mel Sulaver, thank you so much for coming on Wellness Fixes the Pod. I'm so grateful to work alongside someone like you who is really just a huge advocate for women in sport and women's health in general, and doing the work to like educate and then also like clinically work with people one-on-one to really help guide them and help them feel the best in our bodies. So I'm so grateful for you. I'm grateful for all of your efforts and for you coming on the podcast today. So thank you so, so much.
Anytime.
And if you guys are interested in what all Mel's doing, I will leave the links below, but she is nutritionbymel.com. You can follow her at that on Instagram as well. And she does take clients from all over. So if you are looking for more guidance, and again, I think we will cover more of the like pregnancy, postpartum, menopause, all of those stages of life in part 2. But if you're looking for more guidance, or she has like resources upon resources that she can point you in the right direction. So please feel free to reach out to her or follow her newsletter and just get involved in that way. Thank you guys for listening. I hope you guys got a lot out of this episode, and I'll see you guys again on the next episode of Wellness Fixes the Pod.